will move on. On disseminated, very important word is diabetes, we already said. So what are the two complications you monitor diabetic mother are? Is preeclampsia, and what is the second complication for diabetic patients are? Is postpartum bleeding. Are we clear? Next is disseminated intravascular coagulation. Very important wording. It's called DIC. I want you guys, first thing you write down on the top is, this is secondary. That means that's not a diagnosis, but something is going on with the mother, and you monitor the mother. DIC is disseminated intravascular coagulation. That means the mother starts bleeding. Condition is in the mother's body that result, some reason, and we will talk about those reasons, mother start, what problem? Underline the word, exaggerated clots, bleeding problem. Highlight the word, what is DIC? Is, remember the word clot, and remember the word is bleeding. So what is the mother is clotting and bleeding. Next is and microcirculation. So it's a circulation problem. Rapid and extensive formation of clot result in bleeding. So mother is bleeding and causing lot of blood clots. That is DIC. It's called disseminated intravascular coagulation. This word is not only in OB, but this word is a med-surg question. Are we clear? So it can come in med-surg. So when patient has clotting problem, what is the diagnosis is called DIC. And what is DIC is not primary, not the bleeding problem, but there is other condition and lead a clotting disorder. And my patient is going into bleeding and clotting disorder. And what does it cause? Occlusion of the organ or thromboembolism. So what does it cause here? Is clot, because there are a lot of clot, and it can clot the organ. And remember the word thromboembolism, clotting and stopping the organ, not getting more circulation. What are the reasons? What are the reasons of which mother are we going to follow up with DIC? Which mothers are we going to follow up? Number one, abruptio placenta. I will be talking later about abruptio placenta. Remember, there are two kinds of bleeding the mother has. What are the two types of bleeding we have? Placenta previa and abruptio placenta. So if mother is questioned, is admitted with abruptio placenta, what are you monitoring this mother for DIC? She's already bleeding. And that bleeding is causing what? The clotting disorder. So underline the word abruptio placenta. Second thing is hypertension, gestational hypertension, or I want you to highlight the word preeclampsia. So gestational hypertension, add there preeclampsia. Intrauterine fetal death. Number three, babies die in the fetus, fetal death. Babies die. And next is mother is having any liver problem. Even in med-surg question, liver cirrhosis leads bleeding, any liver problem affecting bleeding and clotting. Sepsis, number five, mother has sepsis, means any kind of infection. Septic, mother become infected throughout the body, there's infection, can lead to DIC. Next is amniotic fluid embolism. Amniotic fluid embolism. Now, when the amniotic fluid goes in the blood, that is causing serious problem, and mother can be bleeding. Everyone should know 3 reasons. And what are those very important 3 reasons are? Number 1 is abruptio placenta. Number 2, we remember hypertension or preeclampsia mother. Number 3, we all should know liver disease. Any mother has liver disease. Baby died, a fetal death. Mother don't know for few months and she's not feeling fetal movement and they find out the babies are dead. Can lead to bleeding and clotting disorder. And septic infection can lead to bleeding disorder. And amniotic fluid embolism. Everyone, these are important. Now your questions are never going to be, what is DIC? They're not going to ask you. They're going to say the mother has admitted with abruptio placenta. Or mother, which condition, following condition are you going to monitor for? Is the mother for DIC, disseminated is bleeding disorder. Which are the mothers are high risk? Number 1, think about bleeding. Mother is bleeding, which one? Abruptio. I don't want to go in detail, but when I'll go back abruptio, I will talk more about this again. But what is abruptio placenta? Mother is bleeding. Mother has septic infection, can lead to bleeding and clotting problem. Mother is hypertension leading to this problem. Mother is, the baby died in the fetus. And the question, they worded like that. The mother has fetal death syndrome. What do you monitor mother? Your answer would be DIC. What is DIC? Mother start bleeding and forming the clot and forming this clot and stopping the circulation throughout the body. Data collection. What are the sign and symptom of DIC? What are the sign and symptom are? Number 1 is hematuria. Mother is bleeding, hematuria, vomiting, vaginal bleeding, bruising, purpura, ecchymosis, uncontrolled bleeding. And what is low here? Underline the word fibrinogen is low. Platelet count is low. Hematocrit is low. And presence of fibrin spleen. So remember, it's a bleeding problem. Yes, fibrinogen, platelet count when you have bad, hematocrit would be low, that's your bleeding disorder. Everyone is okay? What are the signs of DIC? Bleeding sign. Mother, maybe they give you the word is patient is having hematuria. Patient is vomiting blood, hematemesis. Patient has a lot of bruising. And patient has ecchymosis, always sign of bleeding. Then what would you do if mother is bleeding? Number 1, cause. Underlying cause. Before you treat the bleeding, you need to know why mother is bleeding. So what do you treat first? The cause. What is the bleeding is leading here? When mother is bleeding, remember shock. Shock, low blood pressure, you guys know, pulse is high, respiration is high. Bleeding lead to hypovolemic shock. Then you will go underneath when you are having lack of bleeding or you lose blood, is you need more oxygenation. You are lacking oxygen. Give oxygen to the mother. Very important, what do you do? Number 3, those are simple things you're going. Number 3 is very important, your answer, heparin. Heparin you're giving, maybe patient gets IV, and heparin you're treating for clotting disorder. And second line, you will go monitor. How do you know mother is getting better? Your answer would be, what do you monitor? Number 4 is urine output. When your circulation improves, your urine output would be more than 30 ml. If it is less than 30 ml, your kidneys are not getting better circulation. And so underline that. Antidote, when someone is bleeding more, you can give them Amicar. Amicar is antidote for bleeding disorder. So Amicar is antidote for your bleeding disorder. So everyone is okay. What is DIC? What is DIC? Secondary. In med search question, OB question, there's something going on with the patient. Maybe they're having a bleeding disorder already, maybe they're having infection, maybe liver cirrhosis patient, maybe they have sepsis, but what are the reasons in pregnant mother are? Number one, we all remember abruptio placenta. Number two, we remember preeclampsia or hypertension. Number three, we remember is fetal death. Babies died and stays longer can lead to is bleeding. Liver problem. Any sepsis and infection can lead to bleeding disorder. Platelet count is low, fibrinogen is low, patient is bleeding, sign and symptoms, all your bleeding sign and symptom, remember? And what do you treat your patient for DIC? Your first thing in your mind, shock. They're bleeding. And what do you do? Maybe your blood transfusion answer, maybe what do you give them? Heparin. And what is the heparin does is taking away, forming the clots, preventing, and if they bleed more, and you can give them is Amicar. Amicar is the antidote. How do you know your patient is getting better or patient is improving? What do you monitor? Urine output. Are we clear? What do you monitor? Your patient is improving, vital sign. Everyone is okay about DIC? Questions are, what is DIC? Disseminated intravascular coagulation. What is the problem with the patient? They're bleeding and they're clotting, and what do? You give heparin and stabilize their shock condition and monitor the urine output. Now I'm going to go ectopic pregnancy question. What is ectopic pregnancy? Is implantation usually occurring where? In ampulla of the fallopian tube. What happened in fallopian tube? Fertilization, right? But after fertilization, implantation. Where is the implantation? I said earlier, in the fundus. But what happened is the baby is growing where? In the fallopian tube. That is your ectopic pregnancy. Ectopic, not a normal pregnancy. The baby is where? Is growing in ampulla of the fallopian. So where does implantation takes place? In the fallopian tube. Where is normal implantation? In the fundus of the uterus. Now data collection. If question come on this ectopic pregnancy, immediately you know ectopic pregnancy means implantation. Is their baby is growing in the fallopian tube instead of the uterus, which is not normal. And what would happen? The mother would feel, number one, abdominal pain and a spotting. I want you to write down on the top cramping. Some question I came across and they gave the word cramping instead of abdominal pain. So number one, abdominal pain, and I want you to write down the word cramping. And you already have abdominal pain. Second thing is spotting, or the word would be bleeding. Spotting to bleeding, vaginal bleeding, and the color is dark red or brown color. That means the sign of rupture. When there is a bleeding, sign of rupture. And also sign of rupture is pain is increasing and pain is going where? To the shoulder. So pain is radiating to the shoulder. It's in the abdomen, but the pain is getting severe and mothers start feeling pain, a lot of, even not only abdomen, but shoulder pain. And sign of shock. Also, there was some question, the answer was stabbing pain in the lower quadrant. I want you to add there also cramping, and also I want you stabbing pain. Pain in lower quadrant. Stabbing pain in the lower quadrant. Cramping, bleeding, and rupture sign, and also it shows the pain is increasing to the shoulder. What are the intervention? Monitor mother for bleeding. She start bleeding, and prevent rupture and shock. So what are you monitoring here? Is the mother, because once she start the bleeding, you're monitoring for shock. So remember, very important, monitor for bleeding and shock. They won't allow the mother to continue the pregnancy. So they got to take out the fetus. And how? Underline the word methotrexate. Methotrexate is folic acid antagonistic, and it inhibits cell division. That means it destroying the fetus. Are we clear? So what is methotrexate is? It's a more cancer medication. And what is methotrexate is doing? Destroying the fetus. And laparotomy. What is laparotomy word is? They have to open the stomach. Laparotomy means they have to open and see, they have to take it out, anything in there. So laparotomy word means they're cutting the abdomen, they're opening, and they're checking the fallopian tube, and they may be doing the surgery and removing the pregnancy. Also antibiotic, and if mother is negative, they may have to give immunoglobulin. So sudden pain is good. Ectopic pregnancy, we already know, is the pregnancy is where implantation is in fallopian tube. What drug do they give them? Methotrexate. What do you monitor for laparotomy? Questions are, remember, it says stomach here. What are the risks for laparotomy? Any question is, remember the word peritonitis. What is this cause here? Peritonitis, infection. Any patient come back after laparotomy, they can also do laparotomy when you have appendix rupture. Any abdominal surgery. Laparotomy means they got to open and they got to see the tubes. And a lot of surgery are done now, laparoscopy. Remember what is laparoscopy? They put small incision, they can look through and they can pull it out. A lot of surgery are done laparoscopy. Remember, laparoscopy is you're looking, it's a scope, and they have like a small incision, not a big incision, but there may be a small incision, they're viewing it and they're removing it. They can do laparoscopy. And remember, in laparoscopy, what gas do they use here? Anybody remember? Carbon dioxide. So CO2 is called carbon dioxide. And what do you have to do for patient here when they put laparoscopy? Ambulation. Why ambulation? Because of the pain. So I'm just adding here, but we must know ectopic pregnancy, that means implantation has taken place in fallopian tube. And what are the signs here? Abdominal pain, spotting, and the bleeding can be more brown color and dark color, and also the pain is getting bad. Sudden stabbing pain can be in the lower quadrant. Some of the question I came across was cramping word, and the medication, they may have to do surgery, they can do laparoscopy, they can do laparotomy, and medication, that means they got to remove the fetus from there because it's not be able to grow there and it's not the right place. So it just multiplying the pregnancy, but they have to give the medication which is called methotrexate. Now, next page, I will move on, fetal death in the uterus. When the fetal death in the uterus, remember, is you are monitoring the mother for what? DIC. Write down on the top, the word is called DIC. Disseminated intravascular coagulation. Intravascular coagulation, fetal death is in, you will call that is fetus died, monitoring for bleeding disorder. Grieving process, baby died. Parents are grieving. Let them hold the baby. Let them give the name. And normal behavior is anger, hostility, and just bear with them, give them support. That may be your answer on the fetal death in the uterus. Next is, I want to go over hereditary mole. What is hereditary mole is not a real pregnancy. And placenta changes chorionic villi, underline the word, is grape-like cluster. What is a hereditary mole? Is a mole. There's no pregnancy. There's no baby. And what is mole is a grape-like cluster. What kind of clusters are? Like a grape-like. So immediately when you say they have a grape-like cluster, immediately first answer, hereditary mole. And it's a non-malignant. Very important word is non-malignant. That means they're non-malignant. First word, grape-like cluster. Second important word is they're non-malignant or may develop, underline the word, choriocarcinoma. Choriocarcinoma. They were non-malignant, but there is a risk for carcinoma. Are we clear? So in your question, what do you monitor? Mother who has hereditary mole carcinoma and choriocarcinoma. How does it look? Grape-like cluster. There's not a baby, but they are multiplying and they are forming the clusters. Next line, data collection. Sign off. What does it lead? If you have mother who has mole, monitor for hypertension and edema, proteinuria, preeclampsia. Very important. What do you monitor when mother has this? Number one, hypertension or preeclampsia. Number two is in the second line, we have very important HCG level is increasing. HCG level in your question, two words are very important here. In your question is number one, grape-like cluster. Second thing, remember you're monitoring for choriocarcinoma. Third thing is HCG level. Throughout their pregnancy, after you'll be monitoring and HCG level is high. And vaginal, and so hypertension, you're monitoring vaginal bleeding. Mother start bleeding. Mother has hypertension. HCG level is high. Mother start bleeding, need to notify the physician. Also, I want you to write down underneath where HCG level, ultrasound. When you do ultrasound, what do you hear? Like a snowstorm. You don't hear the fetal heart rate. So ultrasound, no fetal heart rate. It's like a snow storm, like a storm, and you're hearing the big noises like a snowstorm. But there is no fetal heart rate. Some question, they throw it, and the wording. Wording are choriocarcinoma, grape-like cluster, HCG level is high, and snowstorm, the noise. There is no fetal heart rate. Intervention. It's not a pregnancy. So what do? They have to start Pitocin and oxytocin and evacuate. That means they have to do DNC, remove the mole. And HCG level. Now your question comes, after they have removed the mole, what do? Monitor HCG level every 1 to 2 weeks until your HCG level or pregnancy level are normal because they were high. Once it gets normal HCG level, you got to do every 1 to 2 months your HCG level. Check afterwards. After it comes normal, you still check. And every 1 to 2 months for how long? For 1 year. So they got to monitor for 1 year. And birth control method for 1 year. No pregnancy for 1 year. Lot of people, if it turns cancer, they have to remove even the uterus. Hysterectomy. Are we clear? So sometimes it can be bad. The mole is cancer, and the cancer is already spreading. So they may go on hysterectomy. So everyone, very important, the word is all we talked about. DIC, everyone should know word, disseminated intravascular coagulation. Second word I said, hydrative mole. What is hydrative mole? Now what happens, sperms and ovum, they got united. For some reason, one of them died, maybe a sperm and ovum, and they start forming the cluster. The baby is not formed. So what is it here? There is a more like a grape-like cluster. So you won't see a baby, and is only one part is growing and is causing is the mole. The risk of this mole is carcinoma, and that is why they cannot get pregnant. Even HCG level is normal, they got to still monitor for 1 year. And 1 year, mother will not get pregnant, and no pregnancy should be done. So a lot of teaching question, we are going to get it on this one. But we must know 3 wording. HCG level is high, and you got to monitor. Number 2, remember, is your choriocarcinoma word, and not to get pregnant. Hyperemesis gravidum. What is hyperemesis gravidum? Vomiting. Vomiting is normal. But when somebody has excessive vomiting and it runs longer time, then we diagnose them hyperemesis gravidum. Underline the word, vomiting persists beyond the first trimester. And severe nausea and vomiting. So what is the mother is having? Severe nausea and vomiting. And question, mother is admitted, mother has history of diagnosed as hyperemesis gravidum. What do you do when mother has hyperemesis gravidum? Is monitor for underlying nutrition, electrolytes, fluid imbalance, dehydration. Everyone, we must know your electrolytes for your NCLEX. Electrolytes, sodium, potassium, and all your level, and your diet questions, very important. So remember, you guys start looking your labs. And what do you lead to is when you're vomiting. What does it lead to? When you're acidosis or alkalosis? Alkalosis. And at their alkalosis, weight is important. Monitor for vomiting. Fluid is important. What do you do, mother who is having hyperemesis gravidum? Is IV fluid and electrolytes. Keep monitoring. Fluid imbalance, maintaining. Diet. When you're vomiting, you got to cut down the fat. Easy diet. Give carb and monitor fetal heart rate. Because mother is vomiting, mother is dehydrated, it's going to affect the fetus. So you monitor the fetus. Next is gestational hypertension. Gestational hypertension. What is the meaning gestational hypertension? During pregnancy, mother's blood pressure is higher. And also another word, when you have hypertension, we call the word preeclampsia. So remember, preeclampsia is an gestational hypertension. Monitor the mother for preeclampsia. And when mother has seizure, then we call eclampsia. So what is preeclampsia? Without seizure. What are you controlling in preeclampsia? Seizure. What are we controlling here? Seizure. Then you will go is sign of preeclampsia. What are the signs of preeclampsia are? Number 1, hypertension. Number 2, edema. Number 3, proteinuria. I want you to add on the top, especially every mother, even they have preeclampsia, third trimester. When they're reaching in for trimester, you check the urine. And what are you checking here? Albumin. What is albumin? Is protein. When we say the word proteinuria, means you're checking the protein in the urine. What is another word for protein? Albumin. And albumin is protein. And when they're saying microalbuminuria, that means the albumin is in the urine. Because third trimester, mother is getting more bigger, baby is growing, risk is mother can go into seizure. So what are you assessing? Does it affect the kidneys? And does the kidneys are affected? So what are you monitoring in preeclampsia mothers are? Number 1, edema. Any question? Mother says, my ring is getting tighter. My ankle are swollen. You got to assess the mother for preeclampsia. Mother says, I'm having headache. I'm having visual problem. Sign of hypertension. You're assessing the mother for what? For preeclampsia. Everyone, we must monitor the mother for what? Preeclampsia. And what are we monitoring in the later pregnancy time, third trimester? You do the urine test and you are checking the deep stick. And what are you checking for? Protein. And why? You want to prevent the mother going into seizure. So sign and symptom. Now, which mothers are high risk for preeclampsia or hypertension? Let's go under that. Predisposing factor. Early pregnancy, teenager, 19 years old, primigravida, first time someone who is getting pregnant could be a risk, 19 years age or older, 30 years of age. So everyone keep in your mind, early teenager pregnancy and older as you're getting, risk for preeclampsia. And underline the word is renal disease. Anybody has a kidney problem and diabetic mother. Diabetic affecting the blood vessel and the heart and causing problem with edema and causing problem with the blood pressure. And next is gestational family history. Run in the family, the blood pressure high and family history. So very important, 4 answers here. Which are the mothers you will monitor for gestational hypertension or preeclampsia? Is teenager pregnancy, older age pregnancy, renal mother who is having renal problem, mother who is diabetic, and family history. Complications are, what do you monitor when mother has preeclampsia or hypertension? What is hypertension? Is leading, underline the word abruptio placenta. Abruptio placenta and also DIC. Everyone connect 3 things here. When you have hypertension and when you have someone who is having bleeding disorder, which is called the word DIC. So remember, how you will remember hypertension or preeclampsia leading abruptio placenta and abruptio placenta leading into DIC. Like this, we remember. So someone who is admitted, the blood pressure is high, the risk for preeclampsia. What is preeclampsia leading to the mother here is the bleeding. And what happened is the bleeding. What kind of bleeding? Abruptio placenta. Is a normal placenta. I will talk about that later. But why the mother start bleeding? Because of hypertension, placenta start separating, mother start bleeding. So which mother we are monitoring for preeclampsia? Everyone should know teenager pregnancy, Older mother, diabetic mothers, and renal diseases can lead to what? Hypertension. Hypertension, edema, proteinuria comes later because your hypertension is damaging the kidney. Very important, at the third trimester, we monitor proteinuria. Now, let's go abruptio placenta, disseminated intravascular coagulation and thrombocytopenia, and underline the word intrauterine growth. Baby will not grow, the mother start bleeding. And next word, I like it to write down the word is placental insufficiency. What is the meaning placental insufficiency? Placenta is not getting enough blood. Mother is bleeding. What do? Intervention is monitor the blood pressure, control the blood pressure, and monitor INO. Very important, urine output. That means kidneys are affected. And albumin you monitor. And what do you monitor? The mother here is seizure. And to prevent seizure, we already talked about magnesium sulfate, which is in the last word, in the last slide, magnesium sulfate. Now the next page, I have it here. Toxicity of magnesium sulfate is depressed deep tendon reflexes, respiration, and urine output. Eclampsia means mother is having seizure. What do you do when mother is having seizure? Number one, airway. Give her oxygen. Protect her from injury. Monitor fetal heart rate. And what medication do you give? Now you give again magnesium sulfate. Mother starts seizure. What do you do? These are your answer. Therapeutic level. You got to keep higher magnesium level 4.8 to up till even 9 to prevent from seizure. Monitor blood level, antidote calcium gluconate, and monitor oliguria, pulmonary edema can lead to breathing problem. Now second, so everyone, preeclampsia lead to eclampsia. Last thing, mother is having eclampsia or preeclampsia. What do you monitor the mother who is having preeclampsia, because it leads to bleeding? And another word we call, the word is called HELLP syndrome. What is HELLP? HE means hemolysis. H, hemolysis, blood hemolyzed. And EL, elevated, and liver enzyme. And LP means low platelet. What is low here? Platelet count. What is high here? Liver enzyme. So make sure, highlight the word elevated liver enzyme, low platelet. This syndrome can cause enlarged liver and mothers start bleeding. So what are you monitoring? You're assessing liver and you're monitoring for bleeding. If it is not treated, patient can die because of the bleeding. Treatment, early delivery of the fetus. I want you to write down on the side, avoid palpation. No palpation, because it can rupture the liver, because liver is enlarged. And pain, sign of HELP is pain on the right upper quadrant. So where is the pain? Upper quadrant or epigastric. Tenderness, and I want you to highlight the word. What is it leading to? Hypovolemic shock. So remember, is not only how we know, but remember hypertension, which are the high risk of mothers are. For hypertension, we must know what do you monitor if the mother has preeclampsia, and these are the complications are abruptio placenta. Number one, bleeding. Number two, DIC. Number three, placental insufficiency. And what do we do here? Give them is the magnesium sulfate for the seizure and monitor three things. Everyone must know: DTR, respiration, urine output. What is HELP is elevated liver enzyme and low platelet count. And where is the pain? right upper quadrant. No palpation, mother should be in the hospital, they need to give blood transfusion and maybe plasma, frozen plasma they give them. And mother is treated for shock. So we'll stop here. I will continue tomorrow.